Hey everyone, Andrew Wolfe at the Center for Cosmetic Surgery, and today I want to talk about anesthesia. It's obviously a very natural question to have if you're considering a surgery, which is what kind of anesthesia might I have? Who is going to be the provider giving me that anesthesia? So let's dig into that a little bit. First and foremost, we do have our own surgical facility on site. It's called Apex Surgical Facility. It is a AAAHC certified location. When we moved into our current building back in 2010, the main motivation to do that was to be able to build out our own surgical site. Staff works for us. Our anesthesiologists work for us. So we do have a team of 6 board-certified anesthesiologists. They were specifically chosen because of their excellent clinical skills, but also because they are really excellent people, very calm and reassuring for our patients. Anesthesia can be a stressful topic for some people, and so it helps to have very warm and considerate people who are providing anesthesia for our patients. So let's talk about types of anesthesia that you might choose during a certain procedure. We obviously have local anesthetic, and so local anesthesia is an injection of a numbing medicine into the area that we're working on. It is an excellent choice for lumps and bumps, scar revisions, maybe small areas of liposuction, things that don't require any sort of sedation. That's a perfectly adequate way to do it. If we need to perhaps do a little bit more numbing and somebody has some anxiety associated with it, we can provide oral medication as well. And this can typically be a mild oral sedation involving sedation medications or some narcotics. They can be combined, and that takes the edge off of the injection process. And it works very, very well for a variety of procedures, even up to and including small facelifts. So in a motivated patient, if I'm doing a fairly limited facelift, what we call a mini facelift, that's a procedure I can do very comfortably under local anesthetic with some oral supplementation. One step up from that would be IV sedation, what lots of people call twilight. And now we are employing the skills of our anesthesiologist. We have one of our anesthesiologists there on site. You get an IV. They give you a variety of different medications that give you pain control, that also take the edge off in terms of anxiety. And typically during the numbing portion of the case, you would be more deeply asleep. And so patients typically have no real awareness of what's going on there, and they have no recollection of it. Once the procedure starts, depending on where we're working, there may be variable levels of sedation that continue throughout the case. If we're working on the body, they can keep you a little more deeply sedated because they can supplement oxygen. If we're working on the face, because very commonly I'll do small facelifts under IV sedation, we cannot use supplemental oxygen because of safety concerns. And so typically a patient is numb, but they may be a little more aware of what's going on during the procedure, and that's fine in the right person. You need to be somebody with a fairly calm demeanor. We really shouldn't be testing your pain tolerance much, but you will be hearing what's going on. We tend to play some very relaxing music, but by and large, you must be capable of sitting there for the duration of the surgery without too much challenge. Obviously, we employ general anesthesia for the majority of our cases. So any of our larger body contouring procedures, larger facelifts, extended procedures where we're talking about a long duration, then we will have our anesthesiologist employ general anesthesia. So now you get an IV, and once we're back in the operating room, you are put to sleep with the IV medication. Once you're asleep, the anesthesiologist will place a breathing tube into the back of your throat. That breathing support remains for the duration of the case. And typically there's an anesthetic gas that is keeping you asleep and at a very level degree of anesthesia. And at the end of the case, once we're done with the surgery, the anesthesiologist turns off the gas, they pull out the breathing tube. It is out before you wake up, but then typically you wake up and you're taken back to recovery. There are advantages and drawbacks to all these different types of anesthesia, and typically it's nice to use the lightest degree of anesthesia that will let us do the case safely and comfortably. Fortunately, we have all these options available to us. We have very, very talented providers who can give us whatever degree of anesthesia we need, what you need as a patient. And because we offer all these things, it lets us really choose what's best for the individual. So we're happy to discuss any of these issues further. If you would like to give us a shout, we can be more specific about certain types of procedures you might consider. You're always welcome to talk to anesthesiologists as well, and they're delighted to interact with the patients. So hope this is helpful. Have a lovely day.